Hi all, welcome to our today's webinar. Let's wait a couple of more minutes till everybody has the chance to join us. Welcome, Liz. Now I can see you. Thank you for joining us today.
Good morning.
Good morning. So, okay, let's wait one more minute, please, and then we can start. Thank you. So, I think that we can start. I see my presentation, if you can confirm that. Somebody?
Yeah.
Okay, thank you. So, on. Hello, everyone, and welcome. Thank you for joining us today on our webinar series. This webinar is the second in a row under the Comfort Aids Community Forum Thematic Area 2, entitled Skills to Facilitate the Service Delivery Models, and aims to explore training and development opportunities for healthcare providers and caregivers to enhance their skills and knowledge. My name is Athanasios Politis, and I'm the director of the Director for Lifelong Learning and International Programs in Japan, a Greek partner of Comfort Aids Project, and a network of Greek cities. And I will have the honor to be today's facilitator of this webinar. Before we start, I would like to let you know that everybody is muted. You can post, of course, your question or remarks at any time in the chat, and be aware that the webinar is recorded. Over the next hour or so, we'll be exploring today's topic, And we will talk about training platforms, their content, and much more that provide opportunities for upskilling and much more for our target groups. Okay. We are excited to have with us today three highly experienced scientists and professionals that will help us learn and understand more regarding today's topic. According to how the agenda is structured, I would like to welcome and thank once more Mrs. Vasiliki Kalfa from Aristotle University of Thessaloniki, Mrs. Maral Akhab Babai from European Health Management Association. I hope I pronounce right the name. And
Yes,
last but
it's fine.
thank you. And the last but not least, Mrs. Liz Asal Payne, the founder and CEO from ORCHA Organization Academy. Before we move on, I would just like briefly to mention that this webinar is taking place in the context of our project, which is called Comfort Aids. The full title is Prediction, Monitoring and Personalized Recommendation for Prevention and Relief of Dementia and Frailty. It consists of 39 partners across 12 European countries, has a budget of 17.5 million. It's funded under the Horizon program and has a total duration of 4 years. It aims to foster personalized solutions for prevention of dementia and frailty in general. The consortium consists of 12 universities, 2 big industries, 10 small medium enterprises, 7 healthcare actors, 4 social science and humanities and legal organizations, and of course 4 social multipliers and networks. Our objectives in Comfort Aids is to improve the longevity and quality of life for individuals with dementia and frailty, to address and evaluate complex challenges of aging, dementia, and frailty by combining clinical expertise, technological innovation, and social activation, enhance empowerment and self-management through improved education and digital literacy, and finally, to establish a pan-European person-centric framework that fosters prevention and intervention strategies towards facilitating effective lifestyle and behavioral changes. We in Comfort Aid believe that collaboration is the key that brings together knowledge and passion to transform challenges into solutions. And here is where the Comfort Aid's Community Forum comes into play. What is the CCF? It's a dynamic collaborative network. It is a space to address challenges and share knowledge. It is a mean to give continuity to the project after its end. It is a venue for regular engagement, bringing together partners and stakeholders. The CCF objectives are to ensure continuity and sustainability, to enhance care quality and accessibility, to support and inform the decision makers, to expand awareness and engagement among stakeholders. Who are the members of the CCF, as we call it? They are the end users, of course, the patients, health and care policymakers, health and care providers, health professionals and caregivers, professional bodies and legal compliance companies, researchers, scientific, social and science humanities, health tech companies and small medium enterprises, digital health clusters, and patient advocacy groups. If you are not a member yet, then please visit our space on the web and become one today. So you will be always updated with our latest news, relevant material, and of course our upcoming activities like today's webinar. Today, we are happy to be here all together to implement this second webinar, and we envisage to have our third and final under this thematic area too in the first quarter of 2026, where we will explore and other resources, materials, and support for our target groups. Before we move on with the presentations of our keynote speakers, I would just briefly like to mention some types of training and development opportunities that exist. It is known that healthcare providers and caregivers have access to a wide range of training and development opportunities nowadays. Those trainings can be for mandatory and core skills, which are essential for ensuring a safe and compliant care environment. Those trainings can be for clinical and specialized modules. For example, programs that focus on specific conditions and clinical skills like dementia, Alzheimer, diabetes, and chronic illnesses. There are trainings for soft skills and interpersonal communication, which are very effective and crucial in healthcare nowadays. Of course, trainings in technology and informatics, as healthcare digitizes every day. Training in electronic health records, management telemedicine platforms, and other medical technologies is increasingly important. And of course, we have trainings in leadership and management, more general issues for professionals who seeks some career advancement, like programs in health management, team building, strategic planning, and financial management. They are available among others. These opportunities, of course, are available through various formats, including online learning as we call it, which can be asynchronous models, webinars, and online courses, which are widely available, allowing professionals and caregivers to learn at their own pace and around their schedules. There can be in-person workshops, seminars, which is a traditional classroom setting, and hands-on workshops are used for specific skills development and interactive learning. They can be on-the-job training, methods such as job shadowing, one-on-one coaching, and real-time feedback during procedures which provide practical and real-world experience. And of course, at the end, we have the blended learning method, which is a combination of online and in-person instruction, which often proves most effective for balancing flexibility with practical application. Today, we are going to explore more into the online learning platforms, or learning management system, as we call it. Who are those key providers? Usually, they are on top the educational institutions, universities, colleges, who offer certificate programs and a range of online courses via platforms. They can be professional organizations who provide national certification courses. Even the healthcare systems itself, like hospitals and large organizations, who often have internal academies or partner with training institutes to offer specialized and continuing education. It can be government and non-profit initiatives, like organizations such as World Health Organization, who develops and promotes evidence-based training resources and toolkits, which are often available for free. And at the end, I added different EU initiatives and projects like ours, Comfort Aid, Be Well, and others out there who develop courses, platforms, tools for the target groups. And also, I want to mention here at last the Comfort Aid's Community Forum, which serves as a network for stakeholders to assess innovation insights and discuss best practices and other relevant topics in dementia and frailty care. Thank you very much for your attention. And before we move on, I would like to once more remind you that you are able at any time to write your comment or remark or your question. We will have a dedicated section at the end for all the presenters to read your questions and answered by them. Thank you very much. Now, I would like to welcome on the floor Mrs. Vicky Kalfa, LMS developer and learning analytics researcher from the Lab of Medical Physics and Digital Innovation of Aristoteli University of Thessaloniki. I would like to welcome her on the floor, and please, the floor is yours. Thank you.
Thank you from my side as well for this invitation to talk about a very, very specific project and our work in the Lab of Medical Physics and Digital Innovation of the School of Medicine of Barcelona University. So our work will focus, and this um, presentation will focus on one aspect that was mentioned in the previous presentation about on the Comfort Age project, which is to enhance and empower the empowerment and self-management of older adults with dementia and frailty, and of course help them improve their digital health literacy. So, in order to start this and explain a little bit of what we are doing as a work, let me focus first on what is digital health literacy. If we want to give a little bit of, in one sentence, what it is, let us say that it is digital health literacy is the ability to find, understand, evaluate, and use digital health information and tools to make informed health decisions. This is very, very important, specifically for our target group, which is the older adults. Why, though, it matters? First of all, it matters because it's very critical to be able to navigate modern digital care tools. And what it is found is that there are significant training gaps across older adults, caregivers, and healthcare professionals in the matters of these tools. So we are focusing and we are targeting three major user groups that each one has their own characteristics. So, for example, older adults, there is a wide variation in digital skills. This is influenced by age, by education. So it's very different if you are 60, if you are 70. And of course, the technology exposure that you have. So, for example, if they have grandkids that they help them use smartphones and other tools in order for them later to be able to use the digital health tools. What it is found though that is they have very low digital health literacy, and this makes them have a very reduced access to care, poor self-management, and a very delayed diagnosis, specifically for the older adults that we are focusing on with dementia and frailty. Then we have our second group, which is the informal caregivers. These people have a dual competence. They are focused on managing health data. And of course, part of their work is to support older adults. And this creates a very unique opportunity for them to, if they are informed and if they have developed their digital health literacy, is that they can act as facilitators to the older adults. However, the often lack of training, specifically in privacy, security, and sometimes in interpreting digital health information. And our third group, and very big group, is the healthcare professionals. They require both to have personal digital health literacy level, and of course, to be able to teach, support older adults and caregivers. So, because they are in communication with the other two groups, they need this support in their skills. Um, the digital health literacy training in this group is really integrated in either medical or nursing education, is what we found. And of course, we have found that there are gaps in user-centered design knowledge and accessible communication practice for healthcare professionals. What this creates is specific needs, training needs, gaps, barriers, of course, and what we are facing now is opportunities to create something that will help them. And this is the last part that we will see in later slides, and we will focus upon. So, as you can see here in this table, for older adults, for example, they have the need of video consultations or e-prescriptions as technology advances. They have there. We found that there is a gap of having accessible and personalized digital content, and accessibility is a very, very important factor here. And of course, they have their own barriers, which is the lack of confidence, the lack of access, and of course, fear. fear is a very big part of those barriers. However, we can see, of course, opportunities of having more hands-on workshops, more engaged environments, and gamified environments, if we can say. For informal caregivers, the need is to be able to have some troubleshooting, to some support of tech use for others, and navigating, of course, digital health. There are no, we can see as a gap that there is no formal training pathways for these people because they are, let's say, hidden actors in this communication and this support. So because they are juggling roles in and they have their own barriers, so they are acting for two people, let's say. We can see an opportunity here to have mobile first content, short demo videos, things that they will help them facilitate their time and being time effective. And then, of course, the healthcare professionals, they need to use the health system. They are the first actors of using those systems, and they need to advise their patients using those systems. What they fear is the lack of time, the burnout, and of course, webinars such as this one and other e-learning materials with simulations. We see them as an opportunity to help them focus on these new skills and opportunities. So what we have developed in order to support all of these three user groups is a training and educational toolkit, and we are currently still developing in the Comfort project. What is the training and educational toolkit, or as we call it, TET for short, is a comprehensive and tailored educational platform. It is designed to enhance the digital health literacy of these three groups that I mentioned before, related to dementia and frailty. And it's incorporating interactive, accessible, and personalized learning content. It fosters an engaged and more effective educational experience to empower the users to improve the self-management and, of course, modify the lifestyle behaviors and enhance best practices for daily care. And of course, the very last but not least, help them navigate, be confident about using digital health tools. So what you see here in these pictures is our login page, the first part that the users meet. But first, I will dive a little bit into the content of TED, and then I will showcase a little bit of the actual platform itself. So in order to help them create this, have this content available to them, we have created these thematic areas that you can see here. The two of the thematic areas serve as an onboarding experience to help them be introduced to the health literacy and digital health literacy. It depends, and we will see afterwards, on what their levels are, and we are examining them before introducing them to the onboarding experience. So they are taking some sort of questionnaire to be able to classify them into certain levels depending on what they know of digital health tools and what they don't know, and of course about their own health, so the health literacy part. And then we classify them in either beginner or intermediate level. And these are, the beginner level is the orange one that you can see, and the intermediate level is the gray one. So afterwards, it depends on what they will be focusing on, either it's frailty or if it is dementia, and then they follow a specific pathway. An example of this pathway can be shown here in this slide. So for example, if in the onboarding phase, the user is classified beginner to both health literacy and both digital literacy, then we are advising them to follow the pathway of getting the onboarding experience for the health literacy part, and then following the beginner level. And then if they want to keep continuing to this part, then they will go to the second part, the onboarding part for the digital literacy, and then continue in a more advanced way and further develop their skills. And outside of the content, we have the platform itself. The platform itself has different As I told you, thematic areas that each user has opened depending on their skill. And then this is updated if the skill level continues and progresses. So we are monitoring them to see how the level grows and how they are answering their questions, their quizzes, their interactive experiences, and their more areas are unlocked while they continue to do the okay. In order to help them, though, we have also implemented a more gamified approach. So they are collecting points by completing activities, by seeing videos, reading materials. Of course, we are very, very much focusing on the accessibility part, and they are progressing by leveling up, let's say. So this is more a gamified strategy here behind this. And as I told you, we are very much focused on accessibility. So we have engaged as well widgets and tools inside the platform. For example, on your left, you can see an accessibility menu, and it is a widget that the people with problems with their vision can use and focus on specific areas. And on your right, you can see part of the actual content of they can have quizzes, they can have pictures, and they can be facilitated to learn more and develop their skills. So this is my short presentation in this webinar. I will be happy to take any questions at a later stages or now. And thank you very much for your attention.
Thank you very much, Vasiliki, for your comprehensive presentation. You present us our our TED, as we call it, platform. We are eager and we are starting to see even more things, as this is something that is still in progress, and we are very happy with the progression so far. Thank you very much for that. And now I would like to welcome on the floor Mrs. Maral Akbabai. Sorry for that once more. To introduce us the Be Well e-learning platform and courses. So the floor is yours, Maral. Thank you very much once more for being here with us today.
Thank you very much for inviting me to this webinar. And your pronunciation wasn't too wrong. It's Agababai. So no worries at all. Yes, so I will be starting to share my presentation. Just 1 second. Please let me know if you can see it. Perfect. Okay.
Yes.
Perfect. Well, hello everyone. Again, thank you very much for inviting me to today's webinar. And as already mentioned, I will be talking about the BeWell project and specifically about co-creating the future of the health and care workforce by focusing on the digital and green skills. And as already mentioned before, my name is Maral Agababai. I am the Junior Policy Officer at the European Health Management Association in Brussels, in Belgium. And together with my colleagues, I work on the BeWell project. Just as something as a background information, I would like to highlight that the health and care workforce in the European Union includes approximately 15 million healthcare professionals. And as global megatrends like digital transformation, climate change, and demographic shifts reshape the healthcare sector, it has become more of a priority to address the skills gaps that has already been mentioned in the previous presentation. And this is exactly where I believe that Be Well, as well as Comfort H, I hope I pronounced the project correctly, play a significant role. As already mentioned before, Comfortage focuses on improving prevention, care, and well-being for dementia and frailty through innovative digital and community-based solutions. But for these solutions to actually work in the real-life setting, it's really important that we need a workforce that feels comfortable, skilled, and also prepared to use these innovations. And this is where Be Well comes in. And I would like to touch upon what Be Well is about. BWell has the vision to prepare the health and care workforce as well as the healthcare ecosystem for the twin digital and green transitions. We aim to implement policies at a local, regional, national, as well as a European level, and BWell values patient-centeredness, collaboration, intersectorality, inclusiveness, diversity, comparative research, as well as dynamic coverage. And just to put this in comparison to the previous presentation, which was about the vision of Comfortage, there we also talked about improving or aiming for digital literacy among the healthcare workforce, but more towards dementia and frailty, whereas BWell is really focused on digital and green skills, as well as new emerging occupational profile skills. Here on this slide, you will find 4 different domains of the BWell framework. BWell aims to produce a skill strategy to be implemented at a local, regional, national, and European level through the Pact of Skills. Here I would like to mention as well that the first version of the skill strategy has already been published. However, we're ongoing to create the final version of the skill strategy, which will be aimed to be published next year, 2026. Around the summertime. The other domain of the BWell framework is the development of skills intelligence on the digital and green skills needs of the healthcare workforce, as well as the establishment of a large-scale partnership for the health ecosystem. And last but not least, the development and implementation of the pilot training programs on digital and green skills, as well as for emerging and occupational profiles. And here I would also like again to mention how these 2 projects actually complement each other. Comfortage develops innovative approaches and technologies for dementia and frailty, whereas BWell ensures that the workforce who will actually implement these solutions actually have the skills that they need. And this is also what I would like to focus on today. So today we will take a look on the e-learning courses, which will cover the digital and the green skills, and as mentioned before, the new occupational profile skills. I would like to start with the digital skills. As mentioned before, we have the training programs for digital, green, and new emerging profiles. And the digital skills started piloting in February 2025. They're still ongoing, and they will end, or the piloting phase will stop early December 2025, so end of this year. And on this slide, you will see 12 different digital skills courses that are currently available. We have data analytics with R. We have the basics of data analytics, clinical databases, cybersecurity for healthcare staff, digital skills for nurses and allied healthcare professionals. We have a course about GDPR, healthcare ICT, Microsoft Office and Google Suite knowledge, PACS, problem solving, telemedicine, and telehealth. And on the right side, you will see the number of certificates that were handed out. So a total number of 522 certificates were handed out to those who completed the digital skills courses. And you will see the yellow highlighted that we had the highest respondents or the highest participants for digital skills for nurses and allied healthcare professionals, as well as for the course about Microsoft Office and Google Suite knowledge. And the lowest response rate we had for data analytics with R. And I think this really showcases that these courses or the response rate of these courses depends on the relevancy to the healthcare workforce. We see we have a high rate for digital skills, which this course basically reflects on the basic knowledge of the healthcare system, digitalization, and as well as Microsoft Office. I think we all are aware that we all use it in our everyday life, so it's relevant to deep new knowledge about this. And therefore, the healthcare professionals the upcoming healthcare professionals tend to take courses that are relevant to the daily practice in comparison to courses such as data analytics with R, which is more about understanding or implementing and learning how machine learning works is less relevant to them. So here it really, again, goes back to the point of professionals having that time is a scarce resource for healthcare professionals. And if they do take the time to fill out the surveys, they want to take the time and they want to complete surveys that are relevant to the daily practice. And moving on to the next slide, this is how the digital courses look on our website. You will see a title of the course, a short description, and the languages available. They're currently available in 9 different languages. Moving on to the Green Skills. The Green Skills courses, we have less available than for the digital courses. Here we have 4 Green Skills courses, which also started piloting in February and will end by the end of this year in December. Here, the number of certificates handed out are significantly lower than for the digital courses, as you can tell. Here we only have 198, with the highest certificates handed out to Green Skills for frontline nurses and allied healthcare professionals. And this goes specifically focuses on the introduction of planetary health and planetary health education and interdisciplinary collaboration. And here, as mentioned before, we have a lower number of course completion. And I think this can also be understood or goes back to, again, lack of time, but also lack of awareness and lack of knowledge of Green Skills in the first place, in combination with lack of incentives for healthcare professionals to also take the time to take surveys that are related to Green Skills. And this is how the Green Skills courses look on the website. The same as with the digital courses, we have the title of the courses, a description, as well as the languages that they're available in. Moving on to next generation digital and Green Skills. And this one reflects or refers to the new occupational profile courses. This piloting phase started later in May. It's still ongoing until the end of the year. And these profile courses for the new emerging occupational profile courses, which we also call NEOPS. We had 9 different courses available. We had 3D printing in medicine, AI considerations for GPs, digital care coordination, digital patient education, the development or develop resilience for health operators, the basics of the Medical Device Regulation 2017, XR technologies applied in clinical practice, sustainable logistics and healthcare, as well as radiomics. And just an understanding for those who may not know what new emerging occupational profiles refer to. It refers to occupational profiles that are expected to emerge under the changing healthcare demands. So it's assumed to be roles that require a blend of traditional care service, new digital and green competencies. So it's kind of a combination of all together. And on the right side here, again, you will see the number of certificates handed out. Here we have the lowest of certificates handed out in comparison to the Green Skills and the digital skills with 176. But this can also be due to the fact that the piloting phase has started later. But I also believe that due to the fact that new emerging occupational profile courses are not as understood or not as common as digital courses, and that's also the reason why less professionals take the time to complete these surveys. But here you'll also see that the lowest number of certificates handed out were for AI considerations for GPs, but the highest for develop resilience for health operators. And here the reasoning goes back to the same as for the digital courses. We have AI considerations for GPs, which has the lowest number. It's because it's less relevant to the professionals in comparison to learning how to be more resilient in the healthcare setting. So the course Develop Resilience for Health Operators reflects or includes courses about understanding or focusing on stress management, on critical thinking, on also on communication to enhance personal well-being. whereas AI considerations for GPs is more about AI knowledge for practical applications. And with the rapidly changing healthcare environment sector, it can become more of a priority, but currently in the current daily work setting, it's just not yet. And that's also why there are less professionals taking part in this survey. And then this is also again how the NEOPS look online on our website. Again, as before, we have the title, description, and the languages that they are available in. Coming towards the ending of my presentation, I would also like to highlight the key outcomes of the e-online courses. So through the training programs, which are completed by the healthcare professionals or upcoming healthcare professionals, we have learned that it bridges critical skills gaps. The training programs promote cross-disciplinary collaboration across different sectors, and it provides a flexible and inclusive training framework. And all of it together combined, Be Well and the training programs have a public health impact by creating a more resilient and adaptable health workforce, which is ready to meet the evolving sector demands. And here is as well the link to our website where you can have a look at the e-learning courses, as well as the QR code. If you do not have the time to scan in the QR code, I can share the link with you in the chat. That's not an issue at all. And on the right side, you will also see how the e-learning courses look like, so you can choose which one you would like to participate in. And coming towards the very end, my very last slide, I would also like to invite you to participate in our online publication survey. This survey is available in 9 different languages, and it targets health managers, healthcare professionals, educators and vets, policymakers, as well as patient representatives. And we would like to hear your insights to help us develop the skill strategy for Be Well. Here's a QR code. You can gladly scan in the QR code. And this is gonna be my very last slide. Thank you all for listening to my presentation. If you have any questions about the Be Well project, I'm happy to answer your questions during the Q&A. Otherwise, you can always reach out to me via my email. Thank you very much.
Thank you very much, Maral, for your presentation, and thank you for sharing the insights from Be Well projects and how the trainings and the courses run in the pilot phase that finishes, if I'm not mistaken, this month, yeah, in December, early December, yeah. And
Exactly.
and I really, I totally agree with you that both our projects can have a synergy, and we look forward for that in the future to have other activities or common events or whatever, but we will discuss that with the managers. Thank you once more for your presentation. It was very helpful. And it shows really that digital skills is the top at the moment, right?
Exactly. You need
Okay.
the healthcare workers need the skills to be able to use the new innovations. Without them, it's not useful.
Exactly. So, moving on, I would like to welcome on the floor Mrs. Liz Assal-Payne to give us an introduction to ORCHA Academy training platform and their courses.
Thank you so much, and thank you for inviting me to join you this morning. I will just start the slideshow, and hopefully you can all see that now. So thank you for the introduction. So my name's Liz. I'm the founder at ORCHA. Just to be transparent, ORCHA is not a provider of digital health education. We do it, but it's because our mission is because we want to drive impact on people and patients' lives through the deployment of safe digital health technologies. And as we just heard in the previous two presentations, if the healthcare professional doesn't know about the technology and doesn't know what they can trust, then of course they're not going to use it in their care of patients. Just to take a tiny step back, Orca is all about, as I said, improving lives through digital health, and we do two things to enable that. The first is we quality assure the technologies so that we know which technologies are safe and effective, and then we work with healthcare systems to deploy those technologies. We've been working in this space now for about 10.5 years, and digital health education is absolutely critical to enabling access to new innovative technologies for us as patients. I myself am clinical. My background is in complex paediatric care. And as a frontline healthcare professional, we are never going to recommend something that we don't know about and that we don't trust. And that's why we've got really interested in digital health education and have created a platform to drive that at scale. So just a quick whistle-stop tour of the problem that we're trying to solve. So I don't know if you all know these stats, but when we talk about digital health and digital health technologies, including apps, platforms, etc., there are currently over 365,000 technologies available. And every single day, over 5 million people will download one of these technologies. We now have more smartphones on the planet than we have toilets or toothbrushes. And over 90% of clinicians want to use these technologies with their patients in their care. The big but is research has indicated that less than 20% of all those technologies available to us meet the quality criteria that you would expect. And so, of course, that puts a nervousness into healthcare professionals' minds about whether we should or should not use these technologies with our patients. But equally, it does so for us as people and patients wanting to engage with these new technologies. Research also tells us, though, that if your doctor or nurse or therapist recommends you do something, you are 70% more likely to do that job. And so ensuring that our healthcare professionals know and understand what's out there and then embed it is the biggest deployment opportunity we've got to have a big impact on our citizens and patients' lives. The biggest challenge we've got when it comes to healthcare professionals using these technologies is not that they don't want to use it. In fact, I just mentioned that over 90% of healthcare professionals do believe that these technologies could help their patients' care, but there's a big challenge when it comes to them using it. The first thing is there's literally hundreds of thousands of these technologies. And I can tell you, and I don't know how many clinicians there are on the call today, but our training does not have digital health innovations in there. You may be lucky if you get one short session about digital health. And if you liken that to the education that we receive when we're learning about pharmaceuticals and medicines, of course, we learn about all the different drugs and pharmaceuticals that we can prescribe to our patients, but we're not yet learning in detail about digital health. And what that means is that our healthcare professionals then don't feel confident to recommend them, and therefore the use of these technologies are massively underutilized, which means that our patients aren't getting the benefit. Now, Orca's work pre-COVID, we used to go out and educate the workforce in person. We would go out into hospitals and clinics, and we would run training courses. And then, of course, COVID hit us all, and we thought we need to do this differently. And as such, we decided we would look at all the resources we have and start to create a more online presence that healthcare professionals can access when it suits them rather than when we were available. And it also meant that it then becomes scalable. Now, this training really matters because we're talking about transformational change here. And in order to achieve that change in the way in which clinicians work, they need to feel confident. Quite simply, they need to know what tools exist. They need to understand the risks and the benefits, and they need to be using these technologies in a responsible way. Now, the Digital Health Academy was created based on all the information that we built up in the first 5 years of our work. And basically, it's very practical and accessible education. There are 3 foundation modules which talk about what do we mean when we talk about digital health, what do we need to think about if we're going to use it, and how do I engage my patient. These 3 core modules are free of charge. They're all CPD accredited, and they're rolled out right across the NHS and across Europe. It is, however, only available in English. There's a lot of video content, and the video content is in 5-minute snippets, meaning that if you're a doctor, you can watch 5 minutes in between patients while you're cooking dinner. And as I said, it is fully CPD accredited, which means you get a certificate for the education that you've undertaken. These foundational modules are free and open to all, and you can download it, you can undertake it and use it. We decided that this was critical. The reason being is because the gap in education for frontline healthcare professionals in this space is quite bleak. And there just wasn't anything out there that really started from the ground up. When we did the horizon scanning, we found a lot of education and training for those people who already had some basic understanding, but though we could not find anything that really started from the nuts and bolts. What do we mean when we're talking about digital health, and what does it mean to use it? We also recognise that frontline healthcare professionals do not have the money available to buy into these courses, and so we decided to invest in this ourselves. So these foundational modules are free and open to all. We've had literally thousands, particularly of NHS staff, going through this with incredible feedback. How you access the Academy, you just sign up and log in, and you begin the modules for free. Now, what you can do once you've done those foundational modules, you can then unlock clinical modules. A clinical module is far more than the basic understanding of what is out there and what do I need to think about. This is very much about getting into certain clinical domains. For example, mental health, diabetes, musculoskeletal, respiratory, women's health, etc. And that's because as clinicians and healthcare professionals, that's how we're trained. We're trained along clinical pathways. And so the bespoke offering on top of the foundational modules are very much targeted in that way, so that you can now learn not only what's out there, but what technologies will meet your patient's needs at what point in the pathway. And we have experts talking about this, so experts in diabetes, mental health, etc., in these additional content. What you also get in the Advanced Academy content is the ability to now select and recommend via text message the right technology to your patient at a touch point. One of the things that we talk a lot about in the foundational module is having a safe clinical system for deploying technologies. And unfortunately, of course, waving your phone at a patient is not a safe clinical system. So using the system that you get with the Advanced Academy content means that there is a register of technologies that you have recommended to your patient. And if we in the background find a future fault with that technology, we can do a recall. And therefore you've established a safe deployment route, which you will have thought about in one of the foundational modules. Just to mention, when we built the Academy, and we continue to reiterate and add modules, we co-designed it with clinicians, governing bodies like Royal Colleges, and of course educators. It was informed by literally thousands and thousands of the product reviews that we'd undertaken, any gaps that we'd found, etc. And of course, the way in which we built it is around scale, both on a national level and international level. We've had some amazing real world impact, and you can see a quote there from a lady who leads part of the NHS in the north of England, saying that it's been a big part of their digital health literacy work. What we've seen is improved digital confidence. So we've seen many more technologies being recommended to patients. We've seen better conversations with patients. We've actually seen less patients returning up at clinic because they've been given information that they can now have on their phone for ongoing understanding. And of course, we've seen an increase in safe uptake of high quality technologies, which of course really plays to our mission. We've not stopped. I'm not sure we'll ever stop in this space. Of course, we now need to think about the future of digital health training. More standards are starting to emerge, so I'm quite sure you're all aware of the work that the European Commission are doing around standards, particularly around AI, and what regulators are questioning and asking when it comes to AI and digital health. And of course, we won't stop until we've supported every professional to deliver better digital health to their patients. I will put the link in to the Digital Health Academy, and happy to take any questions. Thank you.
Thank you very much, Liz, for your presentation, for your comprehensive presentation, and your great work that you are doing there in Orca. Now, let's move on to see the chat. This is the time if you have some questions to the keynote speakers, please do so. Let me check. And before we do that, I just wanted to make a question from my side to Maral and Liz. I wanted to ask about the certification or the accreditation, as you said it. From my side, I have this question: whether when somebody finishes, let's say, a course from your academy or from your Be Well platform, does he get a certification of attendance, or he gives some exams to get something more higher, like we say, an accreditation from another organization? And if the courses are somehow accredited, like we say in the European qualification framework or something like that, if there is a correlation. This is a question from my side to both of you, if you can answer it. Thank you.
Yeah, I mean, from the Digital Health Academy perspective, it is all accredited education, and once you've completed, you get asked a series of questions, and then you automatically receive your certification via email. So we've tried to build this as a platform, which then means that there is very little human need for somebody to physically sign the certificate, but of course they do get the signed certification.
I
Thank
can
you, Liz.
also
What?
I can also jump in and
Amaral,
talk
please.
about BWAL quickly. The BWAL courses, as already mentioned before, certificates are handed out to those who have completed all quizzes in a course with a percentage higher of 75%. So they will all automatically be awarded with a certificate through the platform. Regarding the accreditation, it's not all courses of BWAL accredited. There are a few that are accredited by the International Council of Nurses. And if I'm correct, I think it's the digital skills courses, but I do also have people from my project here, so maybe Diane or Dominique in the group chat can help me out with this. But I'm pretty sure it's the digital courses that have been accredited so far. The rest of the courses are we are trying to get accredited, but they are not yet.
Okay, Marlon, thank you very much. So let's move on with the chat. Okay, in between, I can let me make a small poll that we have prepared, so that we get a bit warm. I don't know if you can see it. Okay. So this is a quick poll just to get us warm for a while. It's 5 questions. It's not much. So please, would like your feedback. So the first question, would you be interested in attending an online course within the next 12 months in order to enhance your skills? Yes, no, maybe. Can you see the results on the screen or no? Okay, moving on with the next question. When was the last time you attended an online course to enhance your skills? Within the last 12 months, within the last 2 years, within the last 3 years or more, or never? Nice. Okay. So pretty much most of you within the last 12 months, you've attended an online course to enhance your skills. Great. Let's move on. Please mention which digital skill you would like to enhance as a healthcare provider or caregiver. Use of AI. Okay. Digital health tools. Technology is trustworthy. AI for research. So I see AI and technology in general. Okay. 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 So next question. Yeah, Sarah, I read your comment. Okay. Please rate the most important motive for yourself to attend an online course. So skills, knowledge gain seems to be our priority. Then if it's free or not, then who is the provider that offers the training? Certification given and the format. Okay, so it seems that the most important factor for you all is the skills and the knowledge that you can gain through these courses. Great. And finally, Rate your preferred functionality and features of modern e-learning platform, videos, quizzes, presentation, assessment tools, and gamification aspects. So videos seems to be your favorite functionality feature, let's say. Okay, great. Nice. Okay, let's move on to see on the chat if we have some other questions referring to the keynote speakers. Of course, Liz, Maral, or Vicky, you are free to ask any questions with each other if you want to ask something or to clarify something or to learn something more. You're free to do so, not waiting only from the chat to receive a question.
I mean, one of the things that I think is really challenging in
sure.
the space, and I'm interested in the other speakers' views on this, is how you drive adoption of the courses once you've developed it. And what's the biggest barrier and what's the biggest driver for getting healthcare professionals to get involved?
Is it a question to one of us? I didn't quite. Oh, is it to me?
Sorry, yeah,
Well.
I was asking
sorry.
to either of you, really.
Oh, so the question is, what is the biggest barrier for healthcare professionals to actually complete these surveys?
So no, actually, it's a step before then. How do they even find out about it? How do you get them to become aware and then embrace it?
Oh, dissemination. I think it's all about disseminating the survey. It's you have to share it with the partners of the project that you work in, and then their partners share it with the project partners. So it's all about the network that you work in, and you have to share it. And then once you have shared the training programs with the healthcare professionals, then it comes to the question, do they have the time to fill them out? Then we get to the barriers, actually. It's again, lack of time, because healthcare professionals just time is a scarce resource. They don't necessarily have the time outside of working hours to fill or to take 2 hours of the time to do a course. So I think it again goes back to accreditation. That's super important. If courses are accredited, they can do these courses during their working hours and do not have to take time after working hours and to increase the high workload. So I think it really is interconnected, but it definitely starts with the dissemination of the survey with everyone that you know.
Well, I will quite agree with that. Time or the lack of time is a very big barrier. We do have find out that communities actually help, and we are part of several ones. I think the most important part is to acknowledge exactly what are they gaining before engaging in any kind type of course. So this is the first part of like what will I gain as a healthcare provider in order for me to give my time to attend and learn.
Great. Any other questions between us? Or I don't see any other questions raising from the chat at the moment. Vasiliki already answered in one of those.
I did see that Dominique had her hand raised.
Yeah, I see that before, but okay. Is it still up? No, Dominic. Let me see.
No, there are no hands. Athanasios, no hands. I can't see it.
Dominic, can you hear me? Can you speak? I'm trying to. No, thank you. She says no, thank you.
She says no on the chat.
Okay.
Yes.
Okay. Okay. So if we don't have any questions raised from the chat, Then, and if we don't have any questions among us, Liz, Vicky, or Mara, then we can conclude, I suppose. Okay. Before we conclude, and before we say goodbye to everybody, I would like to inform you that a quality questionnaire will follow right after our webinar. And with that, I would like to thank you, first of all, to thank the keynote speakers, Vicky, Maral, and Liz, for being here with us today and sharing their experiences and insights from their projects, from their organizations, from their work that they do daily. We appreciate your help and your contribution to our Comforted Community Forum. So thank you once more on behalf of everybody for being here with us. And we look forward to have other collaboration and synergies in the future. And if you don't want to say anything, now it's the time to say to everybody goodbye, and of course to thank all the participants for being here. Thank you from my side.
Thank you again for inviting us and for giving us a platform to talk about our projects. It was a pleasure.
Thank you, Marlo. We will be in touch.
It was a pleasure as well.
Yeah, thank you. Thank you very much for the invite.
Thank you, Liz, once more. We'll be
Thank
in
you,
touch.
everyone. Bye-bye.
Bye.
Have a nice
Bye-bye.
day. Bye.
Bye-bye. Have a nice day.